We are looking at all of our guidance based not only on where we are right now in the pandemic, but also on the tools we now have at our disposal.
Straight from the director of the Centers for Disease Control and Prevention, masks are coming off. And just like you heard from Dr. Rochelle Walensky, they're using science to back up their decisions. The CDC now working off of hospitalization metrics to decide if an area should enforce mask mandates. So here's the data for Georgia. We are averaging about 1,500 new cases per day across the state. That is more than a 90% decrease since a little more than a month ago. The state's test positivity rate is now below the 5% threshold. Health leaders say anything above 5% shows a high level of community spread. So what about our hospitalizations? Right now, there are about 1,600 people with the virus in our hospitals. That's between 9 and 10% of all patients statewide. Right now, different agencies across Metro Atlanta are updating their mask policies, including the city of Atlanta and Gwinnett County dropping the mandate for inside locations. Atlanta Public Schools and Gwinnett Schools have also made masks optional. DeKalb County School says it'll make its decision next week on what to do. Several other districts had already pushed ahead with this change. Now, a lot of people have been wondering, why is this happening now, and if doctors think it's the right move. Here's Hope Ford to bring you the answers.
The CDC announcing Friday only communities where hospitals are in high risk or 15% capacity COVID patients should consider a mask. Oakland, Georgia family physician Andrew Reisman says that's a fair metric.
It's been a little scary when we've reached 85%, 90% or 100% capacity. Kind of being able to gauge that you're running into an issue is probably a good idea.
The only hospital region meeting that requirement right now is North Georgia, which includes Dalton and Calhoun. They're currently at 20.9% COVID capacity. Easing mask restrictions is something Dr. Cecil Bennett implemented at his Noonan practice 2 weeks before the CDC's announcement.
I made a policy in my office that any individual who is boosted did not have to wear a mask in my office.
Bennett says data informed his decision.
We may have to treat it just like the common cold or the flu and have some type of booster annually.
He adds this isn't a shocking direction from the CDC, given vaccines, antiviral medications, and foreshadowing from the public.
They were seeing that less of their friends were going to the hospital, less of their friends were getting sick, and they realized that we were in a much better place.
Meanwhile, Dr. Reisman questions how communities surrounding will react if cases rise.
And how do you decide how wide that area is? How would they be informed? How would they respond?
It's not a total goodbye to masks. Face covering still required on planes, trains, and buses, and recommended for high-risk people. On a personal level, Dr. Reisman says he'll be keeping one with him.
In places with lots of strangers, such as stores and things like that, I'll probably still wear my mask despite the new recommendations from the CDC.
Dr. Reisman says he is still going to ask all patients to wear masks in his office because of the likelihood that others may not have strong immune systems. And Dr. Bennett is still requiring unvaccinated and high-risk people to wear a mask in his office. Of course, the CDC encourages people to wear a mask if they want to and says anyone with COVID or COVID symptoms should definitely wear a mask.